Good afternoon and welcome to May 1st, the first day in May. And welcome to the Great Lakes Health Radio program. I'm your host, Francesca Messiah from Kaleida Health. At Kaleida Health, we see people and not just patients. Our topic for today is women's health services. And our guest for today is Kimberlee Bliek. Kimberlee Bliek. Kimberlee is relatively new to Kaleida. We were just chatting before the interview. However, she is Director of Women's Services, which is huge. So, Kimberlee, I want to say welcome, and good afternoon.
Thank you.
Oh,
good afternoon.
Yeah. I'm so glad that we're having this interview because women's health is one of the number one topics when I'm out in the field doing outreach. I always receive a plethora of questions about women's services. So I'm just going to start by opening up. Do you know how many Kaleida Health women's centers are located in Western New York, and how many are in Buffalo?
Well, right now there are three main areas where women can go for women's services that are within the Kaleida Health system. One of those is at Millard Fillmore Suburban. The other is at Women's and Children's Hospital of Buffalo on Bryant Street. And the other is on the ECMC campus, 462 Grider Street.
Okay, and I believe 462 Grider Street is one of our newer locations, and it's a freestanding building. It's a lower building. I know many of the buildings at ECMC are high rises, but the women's services is a low-rise building. Do all the sites provide the same services?
The Grider Street location is mainly focused on outpatient services. Mm-hmm. Both Women's Children's Hospital Buffalo and Millard Fillmore Suburban provide inpatient as well as prenatal testing. For the most part, we have similar services. Women's Children's Hospital Buffalo is a regional care center for NICU. They have a level 3 regional center NICU. At Millard Fillmore Suburban, we have a level 2 NICU. So we do provide a service to that subset of patients. And if those children need additional care above and beyond what we can offer there, they can then get transferred to Children's.
And can I just say for our listeners, what's a NICU?
NICU stands for Neonatal Intensive Care Unit. So it's a place where babies go for care if they're having some special problems or problems related to prematurity.
And basically the point, and then it's to get them to a point where they can go home and be normal and be healthy kids.
Yes, and they do miracles.
Oh, that's wonderful. Now, just back to the Kensington site for a second. Is public transportation available to that site?
Yes, there are the number 13 NFTA bus stops directly in front of the building. Also, there's parking for disabled people on the site that's available.
And I know that, and I believe there's also a parking lot right across.
Yeah.
From the So I just want also to let our listeners know about the ease of convenience of getting to our sites. And and I know at some point in the future, maybe in December or January, we'll be talking about women's services at the new Oshai Hospital.
Yes.
But that's not till until the snow starts falling.
And a lot of other things will happen in between.
And again, that's another reason to check that website. Can family members, make an appointment to discuss women's services, including menopause? Is that something that's also? I know we're talking about children. I know we're talking about women's the big picture until we get. We're going to talk about babies in a minute, but in terms of women's services, if a woman has questions on menopause, can she call or go there to one of our sites?
Absolutely, and usually, they can make a call to the main line at either of those locations, and let them know what they're looking for, what type of provider they'd like to speak with, and then get a provider that they can talk to and answer those questions for them.
Okay, wonderful. And in case you're just joining us, our topic for today from Kaleida Health. We're talking about women services. So, I hope you know, just in case you're joining us, you're wondering what were we discussing. That's what we're talking about today. Now, Kimberlee, many listeners many of our listeners are aware of the drug epidemic in Western New York, and especially heroin. It's awful. There's stories on the news every day, and I know one of the things that we talked about, and we talked about the impact of heroin for a pregnant woman. Mm-hmm. Now, we don't hear about that on television. We hear more about people overdosing, but we really don't hear about the impact that heroin has on a young woman or a woman of childbearing years. Can you tell us something about what can you tell us about that?
Well, apart from the obvious disruption to just life in general, when someone has a substance abuse addiction, when that woman is pregnant, it can create a lot of difficulty for her in terms of how her body is going to react to that pregnancy and how that pregnancy can turn out in the long run, including managing that baby when it's born.
But what does it do to the body? Does it do something to the placenta? Like, does it do something physically to the women, to the baby? Like, is there something else that happens?
Well, most women, if they have a drug addiction like heroin, their self-care is not as good as someone else who is not using a substance in that way. So you have those risk factors. It is known to show that babies do not grow as well in an environment where they're exposed to substances like heroin. Obviously, if mom is not eating properly, that's going to have an impact. But moreover than that, should that woman decide to abruptly stop using that substance, there's a threat for pregnancy loss. On the other hand, we really want people who have a substance abuse or substance use issue to let their providers know, because there is help, and you can get help during your pregnancy to help move you off of that substance onto a medication that will help you manage those withdrawal symptoms, which are, very life-threatening in any state. But if you're pregnant, it can also threaten your pregnancy. And there are medications that providers can prescribe and get you the help that you need, so that when your baby's born, while that baby may still need close monitoring, the risks to that infant and your care will be that much better. And we can then work with you to get you into a program where you can get treatment long term. The opposite end of the spectrum, when we don't know and somebody comes in and they've been using throughout their pregnancy, and maybe they're using multiple different substances, which is often the case, especially lately. We find that heroin's been laced with fentanyl, which is a very dangerous combination.
What is fentanyl? I don't know what.
It's another type of analgesia that,
which is makes you speed, or
it will make you sleepy. It heightens the impact of the heroin. So in combination, it's like taking a super dose of heroin in terms of how it impacts the person. So what if we have a circumstance where someone comes in and they've been using and we don't have, that relationship ahead of time, it's a lot more difficult to manage that newborn when it's born. It's a lot more difficult for us to manage a woman's pain during labor. When we know ahead of time, there's ways that we can help with the pain and manage it through things like epidurals and other ways that we can help somebody who has a substance use issue. When we don't know about it, it makes it more difficult, and we have to watch that baby even that much closer. And the risk to that infant is a lot higher as well.
And I like that you said that, if we know, because I watch television, and some of the television shows, it's like the doctors and everyone seem to know that the pregnant mother is a substance abuse user. But in real life, we have doctors, but you can't always tell, correct? Sometimes you can't, it's not obvious. And that's the reason why you're saying we have to tell, because some people might think, oh, they'll know, they're a nurse, but we have to, that the individual has to let that medical provider know, correct?
Yeah, and really, we're talking about exposure in utero, so exposure to that newborn while mom is still pregnant to a substance that has the potential to impact that baby when it's born. So really, we're not just talking about a street drug like heroin, we're talking about other substances that can potentially impact that baby, OxyContin, other medications that have that sort of addictive quality to them, or maybe there's a legitimate reason that someone is taking those medications. We still need to be cognizant of how that baby's going to do when that baby's born and how we can manage mom's care safely while she's in labor and afterwards, after she's had the baby, so we can make sure she gets the pain control she deserves.
And also, you just made me think of something. So even though heroin and OxyContin and these different drugs are life-threatening, you probably would want to know if a mother is taking a pregnant mom is taking any type of a substance, correct?
Absolutely. I mean, there's, well-prescribed medications that can, we know that they can cause some withdrawal symptoms in the baby. For example, there are some anti-seizure medications that we will need to make sure we watch that baby more closely so that it's safe for the baby, and that, we do what we need to take care of that baby and take care of mom. So it's really about caring for the family and making sure things are safe for everybody.
How about alcohol? Does alcohol, if someone is is there such a thing? Sometimes you're out and you're, and again, I'm just going back to television, because a lot of times, you confuse television with reality, or you call it reality television.
Mm-hmm.
So if someone is pregnant and they're like having a couple glasses of wine a day, it seems harmless, but is that something else that we're equipped for at Women and Children's Hospital? If that, for that mom delivering a baby that might have complications, and does alcohol cause complications?
Well, yes, alcohol is known to create a syndrome in newborns, and it's really not widely known how much alcohol can create that situation. So the standard is to tell women not to drink any alcohol during their pregnancy. And like any substance, if you are using alcohol and you're finding that you need some help to stop using alcohol during your pregnancy, it's really important to talk to your provider, because there are ways we can help you with that. And that's really the important thing right there, is talking about it with your provider or with someone that can help you get the help you need. Is very important for your safety as well as your baby's.
And I guess this goes back to that question that I asked before earlier. What was NICU? And you said it was neonatal intensive care. So for a baby where the mother has been an alcohol or drug user, many times are these babies at Women and Children's or Suburban, I guess, NICU unit? Or sometimes.
There is. Let me just put this in terms of. So there's a broad spectrum of what you might see in one baby or the next, and it really can be very dependent on what types of drugs or medications or what combination of medications were used. So it can be unpredictable. What we do know is there is a period of time, 48 to 96 hours, during which we need to monitor all those babies for certain signs. Now, the best environment for that baby is to stay with its mom, and to be as close to mom for the bonding, for the comfort. we know those babies score lower, and we want them to score lower in that scale. Once they get to a certain point, then we need to think about going to NICU and getting treatment. Okay. And sometimes treatment means that baby gets put on a medication regime using things like morphine or other medications to help them slowly withdraw.
The baby?
The baby, yes.
Okay.
Because really the baby's going through withdrawal. And, you know, as an adult, anybody that's tried to withdraw from drugs, you know what that's like. There's a lot of physical symptoms. It's very disruptive. It can make you very sick and even be potentially fatal for some people to do it on their own. Mm-hmm. So, you know, that's also the case with babies. And so monitoring them and making sure they're not showing signs of severe withdrawal and then putting them on a regime so that they can withdraw safely is really the goal. Not all babies end up having to go to NICU.
And I was just going to say that. So it sounds like the good story is that not all of them go.
Right. And the ones that do better and that maybe show some signs of withdrawal but resolve that very quickly are the ones, usually the babies who we know ahead of time, who were exposed. We know what we're looking for. Or this mom's in treatment. We know she's getting Suboxone or Subutex. And it's a known entity. We know how much, we know how frequent, and we can watch that baby and gauge that treatment a lot better. But no, not all babies end up in NICU on morphine, but a subset of them will. And I can tell you my anecdotal experience, the majority of babies that end up there are those that maybe we didn't know about when they came in, or moms on multiple types of substances that impact that newborn and impact mom. You know, I think the most difficult thing facing the family and the healthcare providers and my nursing staff are really working with that family and patients who come in the door feeling like they're going to be judged right off the bat, and teaching and learning about how we interact with those patients to reduce that feeling of needing to defend themselves and feeling judged when they walk in the door, because we want to partner with them. We really want them to trust, and we want to trust them. So that has to be two ways, right?
Correct. And you know what? And that just leads me right into my next question, which is, for someone listening to the program today, if they're pregnant and a drug user or alcohol user, and they feel ashamed because he may not be able to kick them, but they feel ashamed to make an appointment with Women and Children to come in and to start their treatment, what is some advice that you would give that person so they won't feel ashamed? Like, come on in. What's the advice that you would give that mom or that family member?
Yeah. So they're still going to feel ashamed. I mean, you're going to feel that way. But what you should find is when you walk in the door that you're comforted and that you're told you're in the right place. Yes, we understand that this was something you feel really ashamed about, and we're so glad you came to us to talk about it and to get the help you need. Yes. The shame takes a long time to go away. That's part of the treatment, right?
But they could come with their minister or something. Or
exactly.
A family member.
Bring somebody that they trust to come and hold their hand and have their hand held and work as a family together, whatever family means to them.
Mm-hmm. Oh, I feel comforted. I feel comforted hearing those words. And just so what if someone comes in? What if someone doesn't feel well on the weekend? And I know that the sites don't have evening hours. Mm-hmm. However, where should they go if they're a pregnant mom? Where should she go if she's not feeling well? It's after hours or it's on the weekends. What would you recommend?
Well, I would recommend they go to the emergency department.
Yes.
So that would be the first line of entry into the system. Mm-hmm. And maybe that's the best route for some people because that's where you can see the people that can line you up with the help you need.
And I know that let's say if they go to the emergency department, I know that, and don't be afraid if you don't have health insurance. There is someone there who will sign you up for health insurance. We just want you to go and make sure that your baby is taken care of, and you and your baby are taken care of. So, any last comments before we end?
I also want to just say that New York State is making some strides in addressing addiction and pregnancy, and there's great things coming. I was part of a symposium the other day in Syracuse last week where there was a lot of very good discussion about how can we reach people, how can we help them, because I know how scary it is. And everybody is always afraid of Child Protective Services and all those things that we know are out there, when in reality those things are there to help. And the importance of really just self-disclosing and getting in front of somebody and saying, I need help with this. And those services can be put into place so that they can help you. So, that really, if there was any message I want to send, it's you don't have to be alone. You don't have to be alone. That's a great closing. Kimberlee, I want to thank you, but just one more question. They can call my number at Kaleida Health. I can give them your number. My number is 859-8045. However, do you have a number that you want to give our listeners in case they want to call and make an appointment, or should I just have them call me first and then I'll give them your information? You can certainly reach out to me. Okay. My number is 568-6725. Say that one more time. 568-6725. And if I don't get back to you within 24 hours, call me again. Thank you so much, Kimberlee. Thank you so much. That was wonderful information you've shared with us about, healthy babies. Basically, that's what today's conversation was, healthy babies. So thank you so much for being our guest on the Great Lakes Health Show. Thank you for asking. Thank you. Now, we have announcements. I just wanted to say that in terms of announcements, we do have a few things coming up. On May 20th, I just want to make you aware that we are having another Calling All Men program. This time, again, our Calling All Men program, it's a free prostate screening program in conjunction with Western New York Urology of Western New York, Cancer Care, Rich Products, and the Buffalo Bisons. For men who receive a prostate screening, they will also receive 4 free tickets to be used at any time to the Buffalo Bisons game. We want you to bring the family. We'll have wellness vendors, free food. You can meet the Buffalo Bisons mascot, and that's Buffalo Bison, Buffalo Bill. So please come, and we'll have plenty of vendors and raffles and free gifts. Also coming up, we have coming up on the 4th, on May 4th, we'll be at North Tonawanda City School. On May 6th, Kaleida Health will be at the Bennett High School Community School. And on May 6th, also we'll be in 2 locations at a program taking place at Health Sciences Charter School. And I just want to say, always check our website. That's Kaleida Health. Just Google Kaleida Health, Kaleida. Well, we have come to the close of our program, and I just want to thank you. My name is Francesca Messiah from Kaleida Health, where we see people and not just patients. See you in 2 weeks. Bye-bye.